Welcome back to East Texas Live on KETK. Well, joining us in the living room now is Dr. LaVoy from CHRISTUS Trinity Mother Francis.
And today he's going to talk with us about how to prevent or spread the flu. Good morning.
Good morning.
Now, it seems like the flu season this year was a little later. Seems like people are getting sick now. What can you tell us about it?
Yes, well, actually the past couple of years, not just this year, but last year as well, we've seen the cases really spike a lot later in the season than normal. Usually we see first cases really start out about September, October, and then the season actually lasts down all the way until about mid-May.
Wow.
So a little bit later than most people usually think, but this year we really have only been seeing the cases spike lately.
Why do you think that is, maybe?
Probably to a certain extent better vaccination overall. For the most part, most people start getting their vaccinations about the beginning of September and through that month into October. Unfortunately, the cases will start to spike a little later when you see those vaccination rates so early because the vaccination wears off a little bit earlier too.
So we have parents watching right now. They may be wondering, okay, what do I need to do to ensure that I don't get the flu and that my children don't get the flu?
Sure, and the biggest issue that a lot of parents and kids have is in the schools. The kids will pick it up in the schools for the most part.
Yeah.
The biggest way to prevent it really is vaccination. Try and get that vaccination. I usually recommend to my own patients about October is probably the better time to get it, so that way you have good coverage through until as close to May as you can get.
Yeah.
The other way to do a good vaccination protocol is just make sure that you're going to your doctor regularly and you're talking to your doctor about that. First and foremost though, wash your hands. That is the key. Soap and water is better than anything for the spread of not only flu but any kind of infection. And if you don't have soap and water ready, hand sanitizer is perfectly fine too, especially for viruses like the flu.
Yeah, so when you get the vaccination, how long does it take for it to actually kick in then?
It usually takes about 2 weeks for most people. And a common misnomer is I got the flu vaccine and now I got the flu because of it. Well, no, it's because of that 2-week period. You have to wait for it to really kick in, and in that time you can still get a flu infection.
Yeah.
Okay, doctor. Some people may have not gotten the flu shot yet.
Sure.
Can they still get it, or is it too late?
No, it's not too late. Most primary care doctors should be encouraging their patients to go ahead and get that flu shot if they need an update, especially if you have asthma, diabetes, heart disease, people who are more prone to get flu and have a really serious infection from it.
Well, and you mentioned people maybe got the flu shot so early. Can you get it again then? I mean, should you get it every few months, or?
It's generally recommended once per flu season. It's not recommended necessarily that you get an extra shot later on in the season necessarily, but if you do get symptoms of the flu, you need to get that checked out for sure.
Yeah.
Now, if someone starts feeling those symptoms, what should they do?
Generally, most of the time you want to try and quarantine yourself to a certain extent. You want to make sure that you're not going out in public and coughing around other people. If you have children who are having symptoms, you want to try and keep them home from school, especially if you have a fever, if you're feeling the body aches that are usually accompanying those sort of symptoms. Not everybody who gets the flu will have a fever, so you really want to watch out for that cough, sore throat, runny nose, the body aches that go with it. Those are going to be your main symptoms.
Okay, sounds good. Thank you so much, doctor.
Thank you very
Appreciate it.
much.
Thank you. Appreciate it as well.